与健康之间的我们的活动与健康之间的关系上面的话，我们中心呢也做了一系列的研究，我们将这个活动分成了不同的维度去探讨它跟比如说我们的这个孤独感、我们的失眠的状况以及抑郁之间的这样的一个机制，看到的结果会是在不同种类的这样的一些活动参与之中，我们的有偿劳动与这种 mental health 上面的这个关系与其他的活动类型的关系是相反的。那在我们的环境与健康二者之间的关系上面，我们中心然更多的去关注到的代际健康对于抑郁之间的这样的一个机制。那根据2018年用 Charles 的数据的一个研究，我们同样可以看到，在物理环境跟社会环境上面，不同的环境因素与我们的 depression， 也就是抑郁情绪之间的关系，也呈现出一种非常复杂的一个机制。那在三者关系上讲，坦白讲，在目前的中国的研究里面，对于三者之间的关系的研究并不多见。那我们国家呢，这个在中国大陆地区、中国香港跟中国台湾呢，分别有一部分的研究。我们中心呢，主要的研究呢是在中国大陆地区在探讨三者之间的关系。但是不论是什么样的一些抽样的一些方式，三个地区的这个研究共同指向的一点就是说，尽管我们的环境因素或者是参与或者是说健康，我们在测量的方案或操作化层面上可能会存在一些差异，但这些研究共同指向了一点，就是多元化的环境与健康之间的关系可能会在中间有一个路径，这个路径就是我们的活动参与，它会作为一个中介来存在。这也从实证的层面验证了说，这个我们的老年人的活动参与在影响老年人健康上面的一个非常重要的作用。那基于上面的理论跟实证研究的一些发现，我们提出首先第一点就是要认清说，既然活动参与很重要，那我们要认清说活动参与在中国的这样的一个语境之下，它的文化的特殊性。那根据2018年的一个研究，它指出将中国的这个中国大陆地区的这个 Charles 的数据跟美国以及南韩的这个数据进行了一个对比，我们看到说 caregiving 也就是照料上面，中国的人口是有13%左右的人是参与。那这个有偿劳动是59%，那志愿服务的话是0.58。那这个里面呢，我们看到相比于其他的两个国家来说的话，中国大陆的这个13%的家庭照料也符合到我们的认知，也就是中国的老年人更多的会承担家庭的照料的一些责任，特别是隔代抚养这样的一些工作。那在这个有偿劳动的部分的话，这个比例会远超于我们的想象。那我们的猜测是这样，因为 Charles 的这个数据，其实严格来说，它是一个中老年群体的数据，也就是它的采样的这个最低年龄是在45岁。但因为中国大陆地区是有这个退休年龄的规定的，所以理论上讲，在它的样本里面有相当一部分的人，其实他是在退休年龄之内的，但他还没有退休，所以这个比例会比我们实际的老年人口的有偿劳动的参与要高出不少。那在志愿服务的部分的话，我们会看到，相比于其他两个国家来说的话，中国大陆的这个志愿服务的比例是很低的。那我们中心呢也做了一个纯老年人口的关于活动参与的一个调查，我们用了 EFA 加 cluster analysis， 就是聚类分析的一个方式，会看到我们将65岁以上的老年人最后分析得出他们在参与之中的5种模式，会看到以家庭照料为主的这种模式的比例达到了36%以上。那低参与活动呢，也同样是有36%以上。那刚才有提到的59%的这个有偿劳动呢，在我们65岁以上的样本里面，我们看到的是14.2%的这样的一个水平。但是无论是哪一种模式，同样我们会看到的就是志愿活动的这种参与的可能性都是很低的，所以这个发现也和前面 Charles 的这个结果其实是可以相互去印证的。那中国有自己的一些文化的特征，就像刚才提到的，我们可能更注重家庭的这样的一个责任的承担，特别是隔代抚养。但在西方的话，可能老年人会更多的参与志愿活动啊、宗教类的一些活动。那在休闲方式上，中国的老年人群体有非常大的不同。所以我们在强调说， 这个活动参与对于健康的重要作用的时候，其实也要看到说活动参与在中国的一个文化的特殊性。第二个就是从实证研究的角度上来说的话，目前关于三者机制的这个研究的结论其实仍然是处在不充分的这样的一个状态的。根据很多的研究会看到说环境本身和这个我们的老年人活动参与之间的这个内在机制，它就有非常复杂的这样一套体系。那再加上我们的这个最终的结果，也就是健康的维度之后呢，三者之间的这个机制要远比刚才我展示的要更加的复杂。因为 health 的部分根据 WHO 的定义，它会包括 physical、social 跟 mental。那如果大家有发现的话，会看到前面我分享的多数的研究其实都集中在 mental health， 就是精神健康的这样的一个层面上。事实上，对于三者机制的研究，在身体健康的这个层面上的研究，至少在中国地区的话，还是相对来说比较匮乏的。因此我们会觉得在实证研究的层面上，未来还有很长的路要走。那在提倡中国的这个积极老龄化的这个层面上，我们仍然还要注重中国本土的一些特殊的情况。那其中有一个就是积极老龄化的不均衡发展的问题。那根据刘根阳2019年他们的研究的发现，他将中国的中部、东部跟西部地区的各省市进行了一个积极老龄化指数的测算。我们会看到东部地区的积极老龄化的水平相对较高，而西部地区的水平是最低的。那在各个省市的这个图里面也可以看到，积极老龄化包括社会参与就业等各个面向各个省市的发展也是呈现出一种不平均的状况。那么在具体的我们叫做这个政策跟实证层面上面的话，既然 aging 这件事情不可避免，它是一个客观的一个现实，那我们需要探讨的就是如何从过往的我们既有的印象，把 aging 当成一个老年人当成消极的，然后弱势的，需要别人帮助的群体，转化成现在的这种思维方式，把它当成一个老年人群体当成一个有着长期的这个积累的有文化底蕴的、有经验的，然后可以发挥自己的价值的这样的一个积极活跃的群体。这个理念上的转变其实很重要。另外就是在设计我们的政策跟实践的时候，要坚持这个理论的导向以及这个实证为本的这样的一个策略。那事实上我们的在积极老龄化或生产性老龄化的这个政策上面的话，从1984年开始，我们的这个全国老龄化工作会议，到后面老年人的权益保障法，到全国老龄的11、12、13、5规划，到2019年的这个积极应对人口老龄化中长期规划等等等等。其实中国的政府在应对这个如何积极应对人口老龄化上面是持续的在做努力的。那在此基础之上呢，我们也提倡说社会组织应该在积极应对老龄化里面扮演更加重要的作用。因为在目前来说比如说像这个迎龄行动这样的一些促进积极老龄化的社会公益事业，其实相对来说发展仍然在初期，所以我们仍然希望可以强调说社会组织在我们发展积极老龄化在中国的这个实践上面的一个重要作用。那时间的关系，我的分享就到这里，谢谢大家。
Yeah. Thank you very much, Professor Fu, and for your work on trying to build the evidence base from new data sources like the Charles Survey to think about active aging and new policy development and role of new stakeholders. Let me now switch over to our next speaker, which is Dong-Hee Han, to please give us your views coming from Korea and all the work which you've been doing in Busan. Thank you. You're muted. Can you turn on your mic? Thank you.
Thank you for inviting me to meaningful conference. And then the active aging meaning is the moving to the very challenging the every era. So the active aging lead to the technology for the people 2020. So today I would like to share with you our Korean preparations and also our research institute programs. I'm from Busan City. This is the second largest city and then very beautiful beach. And I really hope to see you next year because there is the International Gerontechnology, the conference in Daegu. And then my institute founded in 1997. And then we are the very challengeable programs. We have done that. So over the 20 years, we spread and then developing the technology programs for all the people, because most people thinking about equipment, but without the understanding all the people, it is very difficult to implant to all the people. That's why we developing the social activities with the technology. And then I think the Asia is very important because over 50% of the person living in the Asia region. So the continually many challenges asked to the this population aging lead our gerontologists. That's why today it is very important to share the ideas active aging. And then Korea is the same, and our populations, all the population is increasing, and the birth rate is down and down. And another the working populations, I mean over the 50 to the 64 is also the increasing, decreasing populations. And then why we need the innovation and the active aging approach. In Asian, most country, our older people is poverty and difficult to the care services, and then isolated, and also the losing their lives. So that's why how can the promoting also the challenge this kind of situations, we need more the technology and the innovations approach. Moreover, the ageism and the global phenomenon this is. So the UN global report, the half of the world population is ageist against the older persons. So we need how can the promote and the empower all the people is a very important issue in the futures. Shortly, I introduced how can our Korea, the active aging society build, and recently we are very interested in the 50 plus, the before the 10 years, our government prepared the later life for them. So the Seoul and Busan and the other city prepared this kind of opportunity to be the social capital and the new image of all the people. And 60 plus Korean Labor Force Development Institute for the aged is also very important because our Korea is a little bit the late preparations national pension system. That's why our government promoting the worker prices. So we developed the age-friendly enterprise and then the senior internship and the enterprise-related employment. This is the government strategy. So another one is over the 302 centers, community basis. We have the elderly welfare center. So this is the platform, the active aging programs in here. And also there are many lifelong learning programs. Also in the university, we developing the age-friendly college and the active aging college too. Also, the health aging in Korea is over 270 centers, community medical center we have those. So we deliver the medical services and also the promoting their health. And also we have the Ansim Center for the deal with the dementia center. This is also the 265 in every community we have to deal with the dementia patient. And the National Health Insurance Service and the long-term care facility has also recently we had set up the community care services. So this is the services integrated care models for the people. And then this due to the coronavirus, we can understand and recognize how much technology is needed. And then, the various app and text message and then robot systems, all the people also connecting this kind of a situation. That's why our Korean society, the understanding how much need aging and tech is very important. That's why the government started the AI counselor, and then everything, the care system is the implant in the technology too. And then this year, the UN also this kind of the digital transformations, the slogans, digital equality for all ages. And also the ASEAN is as a meaning of the human right, the digital divide, how can the bridging the digital divide is very important. I did a training for them. So digital aging is, you must understand the digitalizations. So how can the bridge digital divide and then innovate healthcare system and support the vulnerable life system, and then digital the leisure, new education system, and then digital culture, and the new family solidarity, and the serious game for the dementia patient, and also the safety and the security. This area, the whole thing is I think the digital aging. So, and nowadays, because of the AI and then IoT and the big data and robot, it is much easier infront all the people life with the digital aging. So comparing among the 50 to the 70s, it is getting better. The young older part, they have the internet and the mobile and the PC, but the over 70 is a little bit problem, but we can deliver this kind of assessment. So when we talk the digital divide for the person, the assess is the environment. So the easily can use the smartphone and the PC. But in Korean situations, the capacity and the usage is a problem. So all the people do not, try to use more services. So how can this kind of situation is we are the bridging all the people is very important, I think. That's why our research institute for 20 years, we have done all the people using this kind of digital aging environment. So we are give the chance to understand digital aging as a social activity. So this is for destroy the ageism, and then they can have the new job, something like that. So I would like to share as a picture with you. This is we are every community set up this kind of environment. So the older people teach to the older people, and we call them the internet navigators. So every community they visited there, we are teaching this kind of thing. And also when they are writing the resume, also needed the online spaces. So they teach something like this kind of the empowerment. Also not the online, we have the event, the offline event, and then move to the online. And also we have the intergenerational, the game festivals like this kind of event is helping to understand what kind of benefit we have. Also, we have a lot of the contents, the understanding the later life, the food habits, and also what kind of things needed in later life. So we give a lot of intergenerational relationships, and what kind of good sleeps, and then what kind of elder abuse, what kind of the leisure programs. So we developed a lot of content for the people. And also we developed the cyber neighbor, then cyber family, and the cyber games, AI. This is for the promoting to understand all the people, please to keep your digital life. So this is the kind of opportunity made the better life for the person. So they can do the very independent, and then they enjoy their life with lots of information and lots of the social participations. So recently we are the young generations teach smartphone, and also we are the Zoom education program. So the first time all the people dislike Zoom, but we continually training and training. They move to the Zoom. So we give the overall the travel, and also we give the very nice lectures in the Zoom programs. And also when we have the evidence basis, everything, when we try to showing what kind of program is good for them. So we give just showing the brain activities. So they are very easily, wow, this is a good program, and then exercise needed, why we need they easily understanding this kind of things. And also they can have apply to this kind of skill, I mean the digital skill, and they can have the new jobs, and the trainer, and even they are the drone, the organizers, they apply to the new kind of jobs. So my conclusion is, the paradigm shift. So all the people must to understand the digital transformations, care and the activities, the social participants, everything. So now the AI-based welfare services is much flexible to make the better life for all the people. So we must understanding this kind of things, the smart home, everything. So this kind of innovations, I think the better life for all the people. So the active aging, the concept, the interactions, continue the social participations, health promotion, and the safety and the dignities. So we can apply the digital programs for all the people. So we have done the active aging consortium in Asia Pacific. This is the very volunteer groups, the research center, and then everybody gathering the missionary of active aging. So every time we have every month webinars talking about this kind of issues. Our government continually emphasize the Department of Digital Inclusion and the Aging Tech. And the next year, we have the international Geron Technology conference in Daegu. So I hope that you come to this event. And then I really hope that you understand that digital aging is really important, the material for the empowerment of the people, and then not the isolated, not belong to the society, the digitalizations. So let's keep the movement to go together. Thank you so much.
Thank you very much, Dong-hee. That was extremely interesting and quite amazing, the range of programs that you have. First time I hear the term digital aging, but really you made the case for how important this is for bridging to a new kind of active aging going forward in the future, how critical that is for people to be able to participate and play a part in their communities. Now I'd like to switch to the last presentation, which is from Chu Viet Nga. Sorry for the missing your last name. I'm sorry about that. But she's from the from Help Age International in Vietnam, and we'll be discussing about the Intergenerational Self-Help Club program, which has had an extraordinary history and is now a nationwide program and continuing to evolve as it goes forward. So over to you.
Thank you, Wendy. You pronounced my name correctly, don't worry. Good day, everyone. My name is Nga. I'm hoping you are hearing me well. Okay. I am program manager at Help Age International in Vietnam. And today my presentation is the final one of the active aging session. And I would like to introduce to you about a community-based model called the Intergenerational Self-Help Club, or ISHC for short. And in the next 15 minutes, I will walk with you to answer some questions. Firstly, aging situation in Vietnam, why ISHC was born and was established, and why it brings such characteristics as it does. Secondly, what is an ISHC and what are the healthy and active aging components of a club? And lastly, how to replicate ISHC successfully, and also in different regions as well. I think that my presentation echoes a lot with previous presentations, and you will see me skipping some details that you can read later on in the presentation that I would share with the organizer to send to you. Okay, so firstly, why? What is the background of the club? Vietnam is aging rapidly, and in fact, it is among the fastest aging countries in the world. However, Vietnam is still a developing country with limited resources, and so we are getting rich. We are getting old before we are getting rich. And also, I think the matter of cost is not just for developing countries like Vietnam, but also for even in further more developed country. The cost of care and adaptation to aging is also having challenges on the national budget as well. So we are looking for a model that must be cost effective, must be long-term, sustainable, and also replicable, and it is affordable to the majority of older people's income as well. Some challenges of aging population. It is in Vietnam, but I think that it may have some similarities with other countries as well. The first thing is the income insecurity at older age. Older people have a higher poverty rate in Vietnam, but however, their access to livelihood support program is more limited. It's more difficult for them to access to microcredit, to vocational training, actually. Meanwhile, they are more economically disadvantaged. So when it comes to helping older people with active aging, income security is a factor that we need to consider. And also, older people in Vietnam have low healthy years compared to life expectancy, and NCDs is on the rise, and feminization of aging. More older people are female, and in our national survey, older people face more challenges, both in terms of socially and economically, and in terms of health as well. So we need a model that can target older women and give priority to older women. And majority of older people in Vietnam, people with disability, majority of them are older people, accounting for 70% actually. However, interventions with people with disability focus more on younger people with disability, and there's no or very limited programs for older people with disability. And there's a large migration of younger adults to urban areas. So in rural areas, we see a more faster aging trend. And there's an increase in skipped generation and generation gaps, especially in rural areas. So when we design the model, we have to think of how to bring generations together and how to reduce the gaps and to bring the intergenerational relationship. And violence, neglect, and abuse on older age is a topic that's not yet widely addressed in Vietnam. And sometimes people do not want to talk about this and keep it in behind closed door. And it's only know when it's getting more serious. And also lack of age-friendly facilities and services, especially in rural areas where you see faster aging trend, but the services, age-friendly services like information, transportation, and health and care very lacking in rural areas and in Vietnam nationwide as well. As in the whole country, you only have one hospital specialized in older in older people disease, and it is lacking not in rural areas, but also in urban areas as well. And other factors like COVID-19 and climate change, and lastly, ageism. But on the flip side, there are also opportunities of aging. We have an increasing population of older people with experience, high responsibilities, and high social cause, and they have a voice in their community and in these examples, and they are main carers in their families, and they understand the need of the most vulnerable because they themselves are one of them. So the moment we shift our point of view from seeing older people as only care receiver, dependent and needy and burdened, to valuable untapped resources, then at that moment everything shifts from challenges to opportunities and chances. And so we want to develop a model that is able to harness the untapped valuable sources of older population. And the first step we can do is to listen. And we had consultation with older people, communities, and local partners on our past intervention, and to listen to them and what are their reflect and their feedback on the models. And these are the feedback. During when we had the support from internationally funded project, the project was very successful, but after the project, what happened? Can the intervention keep going? Or it was too expensive to be replicated, or it was done mostly by experts and office and project staff, not done by beneficiaries? Or did we only target poor people or women separately and not in the more comprehensive? And also the service as well, was it comprehensive enough to meet the diverse needs of older people? So expectation of the new model, it should be community-based, it should be affordable, cost-effective, it should link the model with public service and the local government, and it should be empowering the older people themselves and the communities to be able to help themselves, to help the community to help themselves. They understand their need best. They have the answers to their problems, and we just need to provide them with the capacity and the skills and the initial support. So that should be the model that we are looking forward to. So that is the background, and that's how we came up with the intergenerational self-help clubs. And to continue, I will share with you about this model specifically. So ISHC is a social organization that promotes active aging and improve quality of life through community-based, intergenerational, and self-help approaches. And it has received the grand prize of the Healthy Aging Prize in Asia in 2020, the community-based initiative. It was also recognized by UN and by WHO as highlights of active aging and healthy aging in the region and achieving of SDG. And in terms of organizational structure, each club has about 50 to 70 members and has 5 club leaders in the pink tabs that you see here. These 5 club leaders are called a Club Management Board, or CMB for short. Sorry, this is a Club Management Board. And these 5 members are the heart of the club, who will manage everything in collaboration with other members and other service providers in the local community. And The club is divided into smaller teams for better management, and each team has also sub-leaders. So the club is run by older people themselves, and so they decide what is best for them and how they will use their budget and their resources on what activities. And the club also follow the rules of 70%, which is 70% of club members are older people and 30% are younger people, because this is intergenerational. And we are looking at aging. Is it a life cycle approach? We have to prepare for older age ever since we are younger. So having younger members in the club is also preparing for aging. And also we talk a lot about intergenerational relationship. So it's also a way to reduce the gaps among generations. And 70% of club members are female and 30% are male, because proportionally among older people, female older women are more, about 60% already, and they are more disadvantaged. So in a club, there are 70% of club members are female, and 70% are socially and or economically disadvantaged. Normally, for many interventions in Vietnam, focus more on economically disadvantaged people, poor and near poor, but socially disadvantaged, not yet addressed widely. They are older people who live alone, even though they have pension and no economically challenges, but they still face with a lot of difficulties in daily life. They are older people who take care of children in skipped generation families or take care of other family members. They are people who are main carers in their families or people who live alone. They are all socially disadvantaged people, and they are also addressed in the system of the club. And through the club, the most disadvantaged members of the communities can be reached, because the club is set up at the village level. So older people do not have to go far. People with a disability do not have to go far to reach to the service that the club provides, because the club is right there in their community, in their village. The club is multifunctional because as we understood about the determinants of active aging, it has to be comprehensive. And this is address the diverse demand of older people, not just income, but also healthcare, but also lifelong learning, also right and entitlement, and social care and social bonding. And these multiple activities, it must be multifunctional to be able to support each other, like this activity here, resource mobilization. The club runs on its own budget and is able to generate its own income. So there should be a resource mobilization activity area so that the club can generate its income to fund other activities of the club. And these activities actually support each other. And I also have a more detailed slide so you can later read on each activity areas, what are the specific activities that it has. So the question is, with so many activities, how can the club manage? This seems very complicated and so many things in one model. It sounds complex. How can the clubs manage all these activities? Well, in fact, having multiple activities make it easier for the club to function, because it will be more attractive to members and it meets the diverse demand, and the activities actually support each other. Like I said, like in order to have income security, you have to have good health, for example, or you need to receive vocational training, lifelong learning, in order to do a better livelihood model, for example. So it's actually supporting each other, and it has a synergy among these activities. More specific about the healthy and active aging of the clubs. So the clubs provides aging materials to promote self-care, and are very age-friendly, lots of pictures and easy to understand, easy to apply materials. Like these, nutrition for older people, hypertension, heart attack, first aid, physical exercise, all the materials. And also the club organize quarterly communication on self-care. Like this picture you see here, the clubs are learning how to provide care for bedbound person, or learning how to recognize symptoms of hypertension and what to do when you have already had hypertension, what to eat, what not to eat, things like that. And the club also promote physical exercise, non-cost. You don't have to pay to do exercise. You can practice at home. You can play badminton or volleyball or whichever sport you like. And we practice together, so it's more engaging. And also hobby as well, singing and dancing also keep older people active. And also helping to create social bonding as well. And also the club organized monthly health screening with simple indicators like blood pressure, weight, and BMI. And some clubs also have the blood pressure, the blood sugar monitor. So very simple that they can do on their own. And they keep a bookkeeping to monitor the result of the health monthly screening. And also the club collaborate with the health sector to organize health checkup for members twice a year. And also collaborate with the community health station to provide care services for other people in community, especially those in disadvantaged situation. And also promoting access to health insurance. Those who are too poor to purchase the insurance will be supported by the club. And for those who have symptoms of disease, the club will advise them to get to the medical facilities for proper treatment and for early diagnosis. And also support with NCD management in the community as well. And another activities of the club that promote healthy and active aging is the providing home community-based care. These are the care services that the club can provide with social care, personal care, living support care, and health care. All these comprehensive services that the club can provide right at the community with cost-effective characteristic. So who provide care? Older people themselves, club members themselves, those in the community. In our calculation, for every one frail older person in the community, there are 60 active and healthy older persons who are potential carers, and they care for their neighbors and they can provide services like befriending, like Janice said in her presentation as well, befriending or helping with preparing meals, providing information, reading newspapers, or giving massage. Very simple. Reminding the person to take medicines on time, reminding them to drink water, or helping them to get out of the house and walk around. These are very simple, very much needed care services that the community can provide for themselves if promoted effectively and empowered effectively. These are some examples of the activities of volunteers, like helping with the meals. Many older people, when they go to the hospital, they receive care by doctors and nurses, but when they are discharged from the hospital and then they get home, who will provide care for them? Who will help them with the meals, help with the medicine, and help them with the rehabilitation? So volunteers can come in and can help.
Thanks, Nat. Yeah, if you can move towards the conclusion, please. Thanks.
Yes, okay. And for more complicated services, the club can collaborate with the health sectors to provide care. Okay, I will move on to the replication of clubs. So for these replication, our lesson learned is that you need to have pilot model first. Yeah, you need to pilot the model first, and then for the communities and the local authority to see that the model works and it is effective, and then you standardize, and then you introduce it to the wider to policymakers and donors, and then you helping them with replicating the model. And these are the process of scaling up, and with this we were able to scale up the club rapidly in the country, and also not only in Vietnam, but also in other countries have also taken up these models as well. Yeah, and this is the lesson I think that we should have to pilot the model in the community to see the impact. the reason why the club is sustainable and financially sustainable is because the club has a club fund, which is a loan fund, and the club lend out the loan to members, and the members pay interest, and the club will use that interest to fund the yellow activities here, as you can see. So instead of funding the activities directly, we fund the club, and the club will act as a foundation to organize all these activities, and the activities will continue even after the funding from external sources end. So that's why it is sustainable. And these are some evidence of impacts for the years. Okay. It is affordable. It doesn't require long-term investment. Okay, this brings me to the end of my presentation. Thank you for listening.
Thank you very much. And thank you for that in-depth view. We'll also share the presentation with others so that they can see really all of the different components. It's quite a complex but extremely effective program with the intergenerational self-help clubs. So I wanted to open up to some of the questions that we've been getting in the chat. And the first one is from Beijing, and she's really asking Janice, what kinds of programs do you see as being most relevant in some of the low resource settings in the region? And which areas should be led and driven by government as ADB's counterparts? I mean, what should governments be trying to focus on in terms of active aging as critical parts of the programs to start with? Thank you. Over to you, Janice.
Thank you. Thanks for the question. I think one of the programs that can be easily rolled out into the community and at a very affordable level is. So I think the trend of exercise is medicine is one of those areas that we could roll out easily to lower resource or low economy countries. And it's a starting point, because if you can promote to the healthcare providers that exercise is a prescription medicine, to get more people to think differently about how they are living, or the food they eat and the exercise they do, then that's one way that the population is going to age in better health and require less medical services in future. And along with that is a whole program of active aging, being able to organize for some regular exercises and activities in the community. And I think the second lead up to that is being able to engage them with their neighbors, because that is one important way to reduce social isolation. And it depends on the environment as well. I would imagine that if it's a farming community, for example, everyone would know each other. In fact, they might age better than those who are aging in the urban communities, just because of the nature of the social interaction and the nature of work. So it just depends on each community, because you really have to culturalize and adapt the goals of active aging and exercise is medicine to each community to suit them.
Okay, thank you very much. And for the role of governments, what should they be driving?
I think what the government should be driving is more campaigns that could help them, and campaigns that are easily digestible. So it could be using the media, or it could be using the local community networks, the local shopkeepers, to be able to drive messages of eating well. That means we could start with the dietary changes. We could start with exercise goals and challenges. Instead of just saying that we have a poster on eat healthy, it could be we have a campaign. So in the next 12 months, we are going to set up 12 community challenges each month. And in order to, in order to win some of these challenges, you have to fulfill these health and wellness goals. So just to add elements that are easy to do and applicable for that local community and easily achievable.
Okay, thank you. And for Dong-hee, there's a question here. What are the characteristics of a successful digital skills program for older persons? If you were to put 5 or 6 points down, what would be some of the key characteristics?
Yeah, it is not easy, frankly speaking, but the older people trust, or older people recognize the benefit that they can be changed. So we tried to implant to the internet navigator. So the older people teach older people. And then this is the the older people, the trust, this kind of a program is, oh, you can do that, so I can do that, something like that. So comparing the 20 years, before, the desktop was really difficult, but now the smartphone is much easier to access to the internet environment. So one problem is, the comparing the younger generations, they have a lot of the programs and then usage and then activity, but the older people do not have such the activity. So the gerontologists and then government, continually promote, all the people can use the services programs. So we debate the spread a lot of the programs for all the people is very important, I think.
Okay, thank you. And yeah, there's a couple of questions here. One is on how you actually pay how do you recruit paid assistants for the home care? And are there any young elderly employed as care assistants within the program?
Thank you, Wendy. So there are two types of care providers within an ISHC. One is volunteer, no paid, and one is paid care volunteer. Volunteers, they provide more personal care and simple tasks, while paid care assistant, they provide more complicated and medical services. And they are recruited by the club leaders in collaboration with the Association of the Elderly. So the first step is to establish a club. And then the second step is to carry out a need assessment to see what are the needs of the care clients. And then they have like a sheet to list out all the needs, and then they will match. They will match with the care assistant that can provide such services. Paid care assistants are normally retired doctors, nurses, or local health providers, because local health providers, they have to provide care to community anyway, because that is in their job. But with the ISHC, their job is easier because they have a system to support them. So in fact, it's quite easy to recruit them. Because it's in the responsibility. And for retired doctor and nurses, they are older people, they are very willing to help, and they want to help, and they receive recognition from the club. And they receive a recognition from the community when they do such work as well. And also for paid care assistant, the club also pay them some support using the club fund. I mentioned earlier that each club has a revolving fund for loan, right? So they give out the loans and they receive the interest, and the interest rate can be used to fund all activities of the club, including paying for the paid care assistants. And also not just the club interest, the club also generate fund using the public funding scheme. So we teach the club how to mobilize fund on their own, how to call for donors on their own, so they can generate income on their own. In fact, in our over the course of when we fund clubs in 10 provinces, they themselves be able to raise 1.5 million USD themselves. I think in 5 years, themselves. So they can, so once the club are attractive, people will want to support the club, and local government also support the club. In some provinces, whenever a club is established, the local government will invest 50 million BND to that club so that they can run, because they understand that such initial investment can have a long-term benefits.
There's a follow-up here. So families of the elderly and elderly themselves do not have to pay for the home care providers. Is it free of charge? Is it supported by the maybe you can write that answer in the chat box for this one. And I can just add one final question to Professor Fu, which is that one of the things that really stands out in that Charles survey that you showed is the percentage of older persons who are still economically active, still in the labor market. So wondering if in some of this new thinking in the 14th five-year plan or others, if there's any consideration of programs to help older people to stay in the labor market for a longer period of time as a part of overall active aging.
是这样的，就是Charles 的那个数据呢，因为它是全国的一个大型的一个样本的调查，它的这个调查的人口是从45岁开始往上，都是它调查的范围。因为中国的这个退休年龄对于女性来说的话，目前的退休年龄是50或者55，对于男性来说的话，法定退休年龄是60岁。所以理论上讲，在 Charles 的这套数据里面，有相当多的样本量的这样的中老年的群体，他们并没有达到退休年龄，所以被问及这个问题的时候，很多人表示正在 working，是这样的一个状态。所以为什么会有59%的这样的样本是存在他们正在工作的？那我们中国这个北师大的这个老年研究中心，我们自己的调查，65岁以上的老年人，他们的日常活动之中以有偿劳动为主的这一部分的老年人，基本上是14.2%的这样的一个程度。那这个里面呢，我觉得也跟我们的测量方案是有一定的关系的，因为我们在测量里面，因为农村地区其实是没有退休的这样的一个概念的。所以呢，当我们问老人说你是不是还从事有偿劳动？如果他还正在务农的话，那我们还是会认为他是正在工作的。所以我会看到相当大的一个比例的中国的老年人其实正在工作，那可能这个是其中的一个原因吧。
Okay, thank you very much. Well, we're at time, and I just really want to thank all of the presenters today for an excellent overview, looking way far into the future, putting our feet way deeply down on the ground, being in urban areas and rural areas, thinking about really some of the critical constraints and opportunities of digital technology and digital literacy, and of this major shifts in the cohorts of older people as they go forward, and what active aging will really mean for each one. So I thank you very much, and now pass over to Professor Xu for the second session on aged care technology. Thank you.
这一节由我来主持，这一节是关于养老科技。刚才大家都知道，这个上一节里边讨论的很多内容，也都是这个信息技术在养老科技的应用。我们下节的就是这一节的集中了养老科技、信息和科技的养老科技应用。这次呢，这一节呢有3个演讲者，一个是周勇教授，他是华令科技养老理事长。另一位呢是这个刘畅先生，他是健康国际组织中国区的副总裁。然后是伊德先生，是印度尼西亚开发计划署高级政策规划师，社会救助协助员。每个演讲者呢是15分钟，然后15分钟以后呢，我们再进行讨论。就大家提这个针对这个养老科技的问题提出问题。我们会对包括刚才前面的这个session，我们将会给提问的选出2个提问的问题好的，选2个，我们会给送出这个一个非常精美的礼物。那我们现在先让周勇教授来演讲。请周勇来开始讲。
谢谢主持人啊，非常高兴参加这个会议啊，跟大家分享交流中国智慧养老模式的创新以及它应用和特点。大家都知道啊，这个中国呢是人口老龄化速度最快、老年人口最多的一个国家。在应对人口老龄化方面呢，就是中国的政府啊也非常重视啊。我们借鉴国际上的经验，就是健康老龄化和积极老龄化的 这个一个战略目标吧，作为中国应对人口老龄化的一个主要的基点。那么在今年呢，中国政府啊“十四五”规划当中呢，把积极应对人口老龄化上升为一个国家的战略啊。那么这个积极老龄化的一个核心的问题呢，就是鼓励让老年人呢融入到家庭，融入进社区，融入社会，参与一个社会的一个经济和社会活动啊，发挥老年人的一个积极的作用。那么，所以呢，就是这个社区和居家养老是中国一个最主要的一个养老方式，也是绝大多数老年人一个最根本的一个选择吧。所以这个智慧养老或者叫智能化养老呢，它就是针对在这个背景下产生的，也是一个养老服务模式的一个创新吧。主要是为了就是这个在应对人口老龄化这个方面呢，怎么帮助老年人实现一个比较好的、比较高质量的一个居家和社区养老那么早在2012年的时候，我还在全国老龄办任职的时候，我就提出了智能化养老这么一个政策建议在实践当中呢，也进行了一些探索那么也出了一本专著叫《智能养老》我把这个中国对智慧养老这个模式创新的探索分为3个阶段第一个阶段呢是基于电话通讯的一种养老模式我们会在社区里头设一个社区服务中心，服务中心里边有一个呼叫中心，老年人通过电话来向呼叫中心提出他的一个需求，然后服务中心上门给他提供服务。这个阶段大体是在上个世纪末和本世纪初的这么一个时期。第二个阶段呢是基于互联网的一个养老服务的模式那么当这个互联网在中国普及了之后呢，就催生了一个新的养老方式，叫虚拟养老院。虚拟养老院也称之为没有围墙的养老院，就是说老年人住在家里头，通过互联网来对接他的需求和服务那个资源老年人通过互联网提出他的一些服务需求，那么服务的提供商呢也通过互联网他了解这个需求，然后上门给老年人提供各种各样的服务。第3个阶段呢，就是基于互联网加的一个智慧养老服务模式的创新。那么在2015年的时候呢，中国政府也就国务院发布了一个文件，就是要推动这个互联网加快速发展。那么在这个政策的推动下呢，就是养老领域特别是智慧养老领域充分利用物联网、大数据、云计算，还有智能产品等等来探索这个创新的一个新的一个智慧养老服务的模式。这是关于这个模式的创新。那么接下来呢，我给大家分享一下，就是智慧养老这种新的模式，它是在哪些场景应用那么首先最重要的一个应用场景就是保护老年人的人身安全。大家都知道，中国是这个那个老龄化程度很快嘛那么尤其是这种空巢老人和独居老人的比例比较高，已经超过50%多了。那么这些老人面临的许多风险，比如说失智老人他有走失的风险身体功能有障碍的老人他有跌倒的风险，那么还有猝死的风险。那么老年人由于这个年龄的增长经常会忘了关煤气或者水所以有一个家庭里面也有火灾还有漏水的一个风险。所以针对这些风险呢 政府会在那些有需要的老年人家里去安装一些设备感应器那么也会给老年人佩戴一些就是智能化的产品，对吧？就是防止老人跌倒的时候呢，它有一个报警；走失的时候呢，它有一个定位。家里有什么这个出现一个紧急状况，比如说煤气泄漏都会有报警。这种报警信息呢，会上传到一个这个服务中心，服务中心呢就可以派人上门，给老年人提供一些应急救援的服务。这是一个人身安全方面的一个应用场景。第二方面的一个场景呢，就是健康管理服务中国目前呢有2.64亿老人据统计呢，就是患有1种或2种的这个慢性病的老人将近1.8个亿，占70%左右另外我们的失能老人也有4000多万所以在健康智慧的健康管理服务方面我们这个应用也是非常广泛的有这么几类，一个就是健康管理，通过一个智能化的设备给老年人进行一个体检，然后把数据上传到平台，建立健康档案。第二一个呢，针对老年人某一些疾病，比如说高血压心脏病高血糖专门提供一种监测的设备监测它这个数据的一些变化，把数据上传到平台，平台对它进行一个精准化的管理和服务。那么最重要的就是第3类，就是一个风险预警的一个服务。老年人呢，就是说，尤其是独居老人有许多这种特别是许多患有这种心脑血管高风险老人他面临了一个心梗和甚至是猝死的各种风险那么在中国呢，也有媒体报道个别老人因为突发疾病在家里死亡了，也没有人知道这种情况社会影响非常不好对老人的家庭和整个他的生命安全造成了很大的威胁。所以这一类的服务呢，正在中国迅速的推开会在高风险老人家里安装一些就是可穿戴的设备，或者是无接触的设备监测他的一个健康风险。当他数据发生变化的时候呢，能够提前预警提前1周到2周预警他的风险的指数评估的，然后这个数据上传到平台之后呢，平台做出评估，对老人提出一个通过这个短信通过电话通过服务人员上门对老人提供预警的服务。又一类呢，最后一类就是慢病康复的一个智能化的养老服务会研发许多针对老年人这种身体疾病，特别是功能障碍方面的一些帮助老年人实现一个肢体上的一个康复。第3个应用场景就是生活照料服务。生活照料服务呢，就是这个智慧化、智能化，大体上是有两大类，一个就是一个大众化的生活服务那么就是各种电箱平台一个移动终端实现这种生活服务的供给。那么第2类是一个专业化的生活照料服务专业化的照料服务呢，主要是由这个由政府来统筹安排那么有需要的老人呢，就是特别是一些就是在中国政府讲叫托底保障的老人，就是低收入的高龄的，也有就是智能的老人政府会通过购买服务的方式来提供一个生活照料服务那么这些服务呢，都通过那个呼叫中心或者互联网平台和手机的 APP 来进行对接这是一个生活照料服务方面的一些应用。 第4类场景就是一个医疗护理服务。医疗护理服务呢，就是大体上分成2个类型啊，一个是对家庭的居家的护理，智能化护理服务。最近呢，中国政府在提倡居家护理，要求各级政府呢在失能老人家庭建立一个护理床位，护理床位。那么首先呢，会对老人的家里进行一个适老化的改造，然后给他配备上一些生命体征监测的一些设备，那么把这个设备的数据呢和这个平台服务平台和中心对接，然后专门有专业的服务人员根据他的需求和规定时间上门为老年人提供一个护理医疗方面的一些服务那么在政府购买服务以外的那么一个市场化的一个家庭护理服务运输。第2类呢，就是养老机构的一个医疗护理服务这种模式呢，催生了一种叫智慧养老院那么中国政府特别是民政部现在提倡要推动这个智慧养老院建设这个基本的一个服务模式呢，就是设施设备的一个适老化，加上一个服务的平台就是从运营管理包括就是服务还有健康服务等等方面都实现一个智慧化的一个标准。以上呢是关于这个中国智慧养老模式的应用场景的一个介绍。接下来呢，我给大家分享交流一下，就是中国智慧养老方面的一些经验或者体会那么首先呢，就是中国第一点呢，就是中国对智慧养老这个统筹规划的力度是越来越大非常大。那么中国从2017年开始呢，就颁布了第一个智慧健康养老产业发展的行动计划是一个5年计划，从2017年到2020年这么一个5年计划。它是由国家的工信部工业和信息化部、民政部和国家卫生健康委3个部委联合发布一个规划这个规划呢已经执行完毕所以新的一个5年规划又已经发布了在今年2021年的时候呢，我们发布了第2个国家这个智慧养老的一个行动计划这是一个政府从这个规划方面的一个推动。另外呢，政府也会制定了一个推广这个产品和服务的一个目录也是这3个部委制定的叫智慧健康养老产品服务推广目录。那么从18年制定了第1版的推广目录那么今年呢就是去年发布了第2版的2020年发布了第2版的一个产品和服务的推广目录。第3个方面呢，就是一个特点呢，就是说中国政府要求这个全社会积极参与这个智慧养老这方面领域的一些工作今年呢，国务院发了一个文件，叫帮助老年人就是要跨越数字鸿沟，解决老年人智能技术应用方面的困难。那么在国务院文件的这个指导下呢，就是民政部卫健委工信部还有旅游文化等等部门都发布相关的文件要求各级各部门就是要帮助老年人跨越数字鸿沟。另外，所以就是许多的社会组织和企业也纷纷参与进来帮助这个老年人解决一些困难。所以这个智慧养老是中国是一个全社会广泛参与的一个行动。第2个特点呢，就是这个智慧养老市场的需求快速的增长 那么随着老年人口的增长，人消费水平的提高消费能力的提高，以及互联网和电子产品、信息产品的一个快速的发展，推动了这个智慧养老需求的一个持续的增长。那么中国呢，一个人口老龄化快速增长，中国一个就是从2013年开始进入人口老龄化一个快速发展期，就是60岁以上老年人口平均每年要增加1000万。这个快速增长期呢，长达20年，到2025年的时候我们老年人口2033年的时候要超过4个亿那么另一方面呢，就是说中国与空巢老人的比例比较高，失能的高龄老人不断的增长，所以这个对这个智慧健康养老服务方面的需求特别是紧急救助的一些方面的需求日益的凸显。第三一个特点呢，就是一个智能技术产品创新的速度加快这个主要有这么一个特色一个就是智能产品功能的适老化程度越来越高许多这种因为老年人他面临的应用应用这个智能技术方面它存在一些困难，所以现在我们的产品呢越来越适老化，操作上越来越简单，更加方便老年人使用。第二个产品越来越多样化，服务越来越精准，所以这个针对老年人某一项的特殊需求的产品越来越多。第三个趋势。第三个趋势呢，就是这个平台的开放程度越来越高，许多信息实现了互联互通、数据共享这是一个我们这个第三方面的一个。第四一个呢，就是产品和服务的更加融合，就是在智能养老方面一个最重要的一个问题或者叫教训就是这个线上的服务和线下的服务它是脱节的。这样的话呢，会影响到老年人对智能产品的一些应用，所以目前呢，现在已经开始认识到这个问题所以这个产品的生产和服务提供线上的服务和线下的服务越来越趋于融合所以我认为这是一个非常重要的一个问题，非常重要的一个经验如果只有线上的服务，没有线下的服务，这个智能化它会普及程度会降低。老年人用了一段时间之后，他会放弃这个智能化的设备的使用这就是我们得到的这么一个经验，希望对大家有所帮助。好的，我的分享就到这里结束了，谢谢大家。谢谢。主持人，
谢谢周勇理事长的讲。刚才中国的养老服务，这个智能养老进行了全面系统的介绍。现在我们由刘畅先生也讲。
好的。我来分享屏幕。大家可以看到我的屏幕吗？ because 因为我的那个PPT 是用英文做的，我就用英文来做 presentation 后面也跟大家更多的交流。Thanks Prof. Zhou and Wendy and the ADB colleagues. And also the other aging experts in today's discussion. It's a great pleasure to join today's session in sharing our work in the past on smart aging innovation in China. Especially, I will be focusing on sharing the recent report we published 2 months ago on smart aging in China, which we documented about 20 case studies. A little bit background of Access Health. We are a leading global health catalyst in the healthcare and aging domain. we're a vision-driven organization trying to promote high quality and affordable health and aging services. So we're really trying to promote validation and measurements in quality for more integrated services in healthcare and elder care. And also we're trying to promote more accessibility and affordability for the services across the world. We have our operation in the US, in Europe, and also a lot of countries in Asia. I'm responsible for Greater China and Southeast Asia for Access Health. One of the projects we have done in the aging space, has been over 10 years, is called Modern Aging. The Chinese name is 摩登乐龄. Modern Aging is a very interesting program that we have run, really trying to solve some of the key challenges for aging innovation. Because we see in the last few decades, there's a big trend in digital transformation globally. And a lot of entrepreneurs and technology has been invented and applied in healthcare in broader field of society. But there's some divide because a lot of the innovators and technology experts are not that familiar with the elderly community and the aging population themselves. And so we see much fewer innovation applying those innovative technology and also design thinking for providing solution for the elderly. So we created this program to really trying to create three key changes. One is to systematically documenting the elderly's needs for the aging society and to provide that to the technology entrepreneurial communities and to generate interest and more broader understanding of the aging sector needs to enable the entrepreneurs in developing innovative solutions. And secondly, we're consistently promoting design thinking approach in designing services and products for the elderly population to really making the solutions, both product and services, more people-centered. And then we are also have been sort of doing partnering with universities and entrepreneur and incubators, accelerators, to trying to encourage more young people to be interested and starting to creating business, generating ideas for the aging population. So we have been having this Modern Aging program for over 10 years, started in Sweden and then in Singapore for the last 7 years. And then China has been one of the more established program we built, have really continuing activities for incubation and acceleration in the last 5 years, by which we reached over 500 small business and startups and businesses in aging domain, mostly related to leveraging technology for providing aging solutions. And we're now also expanding this program to Japan and hopefully to other parts of Asia. So I just want to mention that. So the study we're doing is part of the initiative. So in this program, not only we're doing the incubator and acceleration programs, but also producing a lot of knowledge products in either understanding the needs for the elderly to showing to the technology community, as well as documenting some of the best practices to help the replication and adaptation. So today, I will mainly focus on introducing the recent report we published a few months ago. It's the Smart Aging Innovation Report. So here's the table of content. But basically, I think a lot of the content has been covered by Prof. Zhu, especially on the policy side, and also the sort of categorization of the smart aging applications. So I think I will focus a little bit more on the industry participation, the detailed applications of subcategories of the smart aging, as well as some interesting cases that we documented in this report. So here's the background of China Aging Society. I think a lot of the speakers has already shared how rapidly China is having the population aging trends. I think we summarized this into the two highs, one exit and one alone. So we have really high population aging speed, high aging proportion in terms of the total population, and also the elderly care burden exceeds starting to exceed the child care burden. And there's also a growing scale of empty nester in China. So that's have been creating a lot of challenges to elderly care as well as the broader aging society. As a response, the national government has launched numerous national policy, starting from 2013, really the law of people's of China on the protection of the rights and interests of the elderly. And there's the key milestone in 2018, which the government established the Division of Aging and Health in the National Health Commission. And then also in the year of 2020, I think it's important for the senior care, for the elderly care and broader aging industry, officially having that statistical classification of 12 categories of the elderly care industry in China. But in the last 3 years, from 2019 to last year and this year, there are a lot of even higher level national strategy and the policy have formed, really putting aging as one of the key national priorities and strategies. So we identified some of the key challenges of these demographic shifts, but I think there are also potential opportunity for applying technology in providing solutions. So we list the challenges on the left. Certainly the life expectancy, as the life expectancy increases, the number of elderly with chronic illness and related complications increase significantly. And the increase in life expectancy and in economic also sort of speed up the diversified healthcare needs for the elderly as well. And also the changes in family structure really reduce the opportunity of informal care, and also government set direction in having the home and community formal care become the standard of care. And that has really created new challenges and opportunities in designing those new care models. And the fourth one is the development of pension industry, still in infancy, although has been 20 years in the design, but the three supporting pillars haven't yet been fully matured. So I think technology really potentially be able to address some of all of those challenges in at least contributing to the solutions by enable people-centered applications. So later we'll be presenting some of the specific applications that we see has been developed by leveraging various technologies. And then, but also leveraging those applications to build people-centered innovative care models that really addressing challenging 3 on the left. And then also certainly leveraging those service model to be able to upgrade the home, community, and institutional elder care, the entire system, 3-tiered system, being more integrated and also enabled, empowered by technology. And lastly, the cross-industry collaboration from digital technology, even finance and elderly care can be facilitated by technology and data, so that might be able to create new solutions, not only in care, but also in other domains that are relevant to aging services, including financing and pension. Here's the definition we use for smart aging. So this really we're taking from the action plan for the development of the smart healthy aging industry of 2017 to 2020. It's defined as an Internet of Things and information platform for the elderly at home, in communities, and in elder care institutions, which on this basis to provide real-time, fast, efficient, and low-cost, interconnected, and smart elderly services. So basically, it defines some of the key technology we used, including Internet of Things, mobile computing, and other information technologies. But also sort of defined as need to build an advanced information technology platform to provide that connectivity role. and in leveraging various resources from different stakeholders in the total provision of services. And also on the service and care model side, to be able to leveraging those the platform technology applications to transform the traditional labor-focused care model to a more intelligent and automated care model. So here we summarize some of the key policies relevant to smart aging in China. I think I just want to highlight a few. Certainly, Prof. Zhu just now already mentioned the 13th and 14th national 5-year national plan for the aging industry development. I think they both highlighted Internet Plus elderly care and even Internet Plus pension as important element in the aging industry, and also to support and encourage private sector participation in really either developing applications, but also directly the provision of care and services. Another, I think, key policy here is in 2020, there is a guiding opinion on the promotion of Internet Plus medical services and medical insurance payment by National Health Security Authority. This is really sort of one of the key policy to start looking at reimbursement and financing for the digital technology-enabled services in both medical care and also potentially extended to rehabilitation and elderly care. Most recently, the CASST and CAST together launched a 3-year plan of action on smart technology-enabled aging to really promoting expansion of the scope of digital education, service capabilities, and to really highlighting the needs to decrease the digital divide and create a more aging-friendly society. So I think that's very, very important, also addressed by Prof. Zhu just now, that China really has starting to, in a national strategic level, looking at how to systematically reduce the digital divide as the entire society is under rapid transformation. So I think this is a key slide. This is based on a lot of interviews and desktop research. We sort of have the broader categorization on the smart aging applications, and then also listed some specific applications under each domain. So we basically summarize this into 5 categories, including digital health, digitization-enabled aging health management. So the 2 applications we listed here, also I think some are mentioned by Prof. Zhu just now, including early detection and diagnosis, chronic illness, medical adherence and management. And the second one is smart daily living and smart technology-enabled age-friendly living. And then the third one is smart care, including home, community, and institution. So basically leveraging technology to enable home, community, and institutional care. And the fourth one is smart health and elderly care integration. So I think technology has really key role and opportunity to promote integration as health and elderly care integration become one of the key direction that the government is pushing. It has also an important role to play leveraging technology. And the third one, the fifth one is smart aging financial technology. This is very interesting, and I think one of the rapid development area in China, whereby a lot of fintech and insurtech companies are leveraging digital solution and other technologies, information technologies, in promoting and designing innovative financial products that might be able to address the aging challenges. So we just, for the time being, give 3 key interesting small cases. The first one is in basically our first category, digitization-enabled aging health management. So this is a company called Thought. It's really a very clinical validated physical sign medical sensor. I think the highlights of this case is that it really leveraging various technologies, not only AI, but also sensoring, but also smart material, innovative material. The combined technology really making this much smarter, but also user-friendly, and has better opportunity to integrating both with the institutional setting, but also at home setting for monitoring. So I think the key for this is really the integration and adoption of various technology into one solution. And the second case we have here is the smart care for home and community and institution. Pine Tree, I think, is a well-known organization in the region that really a leader for leveraging technology to promote rehabilitation and integrated elderly care. I think the key words for this case should be care integration. So really integrating more of the clinical medical care to post-acute services in rehabilitation and to home care. And also, I think has a although it's a strongly leveraging technology, but focus on using technology to building their manpower and capacity building. So that is a great integration between the human care and the technology enabling human care, and also emphasizing on clinical evidence generation and validation. And the third case is a case from the smart aging financial technology domain. So this is very interesting by this organization, CareLink. It's launched together, partner with the insurance company and fintech in designing a comprehensive care and rehabilitation service package that package it into an insurance product. So basically, it's an insurance product for elderly with fracture, and then but they leveraging this financial tool to build a real comprehensive total wellness program, including medical, elderly, long-term care, and also other wellness services into one comprehensive package but making it accessible and be able to covering more people through the financial product. So lastly, we also listed some policy recommendations and also suggestions for the private sector. I think really in the future, it's very, very important to have the building a more common understanding between the public and private sector, and then promoting private sector participation. And I think now some of the key players in the technology sector are really already sort of impacting the entire society. So I think for them to clearly realize the challenges that elderly are facing and more proactively creating solutions that be able to enable inclusive activity for the elderly in the society, and also enabling the care for them will be very, very important. So I think lastly, I want to highlight certainly as the digital economic booming also really rapidly happening in other parts of Asia, especially ASEAN and also India. I think digital health related and digital aging related solutions are also have huge opportunity in sort of accelerating the innovation. But I think in the same time, some of the challenges we see in China, especially in terms of digital divide, can be addressed in the earlier stage as those economies started to really embracing the digital transformation in the entire society. So besides the report I just described, we have been through the model aging program launching various reports every year. Especially last year, I think it's an interesting collaboration with PBM's PHBS, Peking University Business School, on documenting some of the technology opportunity for the era of aging. So we sort of scanned about 20 applications, domains, and look at the opportunities and best practices in Asia and also in China. Okay, that's my presentation. Look forward to the Q&A later. Thank you.
谢谢刘畅博士的演讲。您刚才的演讲不仅讲到了这个中国的政策，智慧养老政策，同时呢，把智慧养老能实现的功能做了非常详细的介绍。就您的报告和朱勇的报告结合在一起，可以 你可以看到，就是这个智能养老在中国的政策中是非常密切结合的。那我们现在让请 Dina 开始嘛，就来演讲。
You're muted, Dinar.
Can you hear me now?
Yes.
Okay, thank you. I'm sorry about that. Thank you everyone again. Good morning. I'm happy to join the conversation and the discussion today. A lot of innovative and very progressive examples have been given by previous speakers, and we are not that far yet in Indonesia, but hopefully we will be able to catch up soon. For now, I will be sharing some progress, some innovative plan for older people care that we have been developing, supported by colleagues from ADB under Wendy's leadership. So our team is from the Ministry of the National Development Planning of Indonesia, and we kind of hope that this forum will let many international academics know about the progress in Indonesia, and of course, to be the opportunity for us to discuss about and get some inputs about the development of the system in Indonesia. Can we go to the next slide, please? So this is the situation of Indonesia, that currently 1 out of 10 citizens is older people in Indonesia. We are fastly reaching the aging population, and by 2045, about 100 years after Indonesia's independence in 1945, we will have about 25% of our population being older population. In a way, this is an opportunity for us to develop a silver economy, and this will be one of the biggest silver market in the world as well, considering our population size is pretty big. So this can be an opportunity for us if we prepare it properly. Next slide, please. However, we do face some challenges. We have been a very young population for many decades, and many of us, including the policymakers, still think that we are a young population. So a lot of mainstreaming have to be done to make everyone aware that we are facing this population change, and we have to be ready in order for us to make sure that we will be able to maintain the welfare, the well-being of all population, mostly the older population. Currently, based on the latest situation, the poverty among older people in Indonesia is higher than average. Currently, our poverty rate is about 10%, and among the older population, our poverty rate can reach up to 13%. And when we go to the oldest group of our older population, above 70, the poverty rate can even double, nearing to 18 to 19%. So this is an issue that our older population is facing, more vulnerable situation. Female older people, like everywhere else, live longer and are the most vulnerable, mostly because involvement in the labor market is more dominated by male. So female older people usually are left without skills and without income security, especially when they get older and live by themselves. The social security in Indonesia is still growing and developing. We really hope to be able to expand in the coming years, but currently among all older people, only 12% are in the pension system. So the rest are dependent on the family as well as the community. And many of them are also still very active in the labor market. Social assistance coverage is quite decent for Indonesia. We have quite large coverage of social assistance, and the adequacy is quite good as well. However, many of the social assistance are geared to families and not to individuals. So even though we can assume that older people in the families, they also enjoy and get protected by the social assistance. However, we are never sure if they receive proper division or a portion of the social assistance that are provided by the government, especially since there have been some discrimination within family as well to the more marginalized family members, as such as older people and people with disabilities. So current comprehensive services cover very few, I would say, and we are trying to expand this. And most programs, they are provided by different ministries, are still quite segmented and not well coordinated. And the last, digital literacy is quite low. The gap is pretty high between the older population and the younger group. And among the older population, the digital literacy is probably just half of the national average. So the gap is quite significant. Next. So in 2019, to address the situation as well as to make us to be more ready in facing the aging population that is coming very quickly, we developed a pilot of what we call as the integrated older people care. We start by developing a database called Silani, and Silani means in English as Older People Information System. And we do think that starting from the data availability, we will be able to build a better integrated older people care. Unfortunately, when Silani was developed, we didn't really have any survey or database dedicated for older people. So we never really understand the situation of older people and the vulnerability that they are facing. So Silani tries to solve the problem. Currently, Silani is covering several types of quite detailed information of older population, including the socioeconomic assessment that is quite comprehensive, assessing their poverty status and rank their poverty status nationally using the proxy means testing. This is linked to the National Social Protection Targeting Mechanism as well as the civil registration system, even though not all the linkages are now perfectly done yet, but this is at least our vision. And then other than socioeconomic, we have health assessment as well for physical and psychosocial. We are using 5 domains: the ADL, IADL, disability status, geriatric depression scale, and dementia using mini cognitive. And also in the Silani, we are adding additional information as well as geolocation information, availability of closest service providers, information of caregivers, and perception of most needed services or supports. So Silani has been piloted in 7 villages across Indonesia, covering about 15,000 older people. We did the data collection like a census style data, and we managed to cover more than, I think, 95% of older people in these 7 villages. So at least in these 7 villages, we have a complete data on the vulnerability, status, needs of the older people. Next. So this is how we try to define the how we try to define the needs of older people using Silani. I'm sorry, this is printed from a PowerPoint to PDF, so this is not very clear, and some are still in Bahasa. But basically, we divided the older people into 3 categories. The upper left would be the healthy one, older people that do not have serious health problems. They are pretty much still quite healthy. And then in the lower left are older people that start to face 1 or 2 health problems. They are still pretty much quite healthy, but there have been some early indications of problems in their health status and their ability to fulfill their daily needs. And then in the right side, we call it L1 to L4, are the categories for older people that are frail and vulnerable. They are facing a quite higher degree of health problems, and they, in theory, are not supposed to be living by themselves and have to be receiving some type of long-term care to make sure that they are able to conduct their daily activities more properly. So this is how then we analyze the data of Silani in these 7 villages in trying to understand the situation of older people in Indonesia. Since this is only covering 7 villages, this will not be super representative to Indonesian situation. However, this is the best data that we have now to kind of see or predict the situation of the older people in Indonesia at large. Next slide. So let's focus on the left side of the presentation first, that based on the Silani, in those 7 villages, about 10% of older people are in need of LTC. This is, if you remember, are those categorized on the right side, on the right-hand side of the presentation in the previous slide. About 1% older people, they are in need of LTC, but they don't have anyone to take care of them. They don't have any caregiver. Family members are the most common caregivers. About 80% of all caregivers are family members, and most of them are not formally trained as caregiver. 90% older people are quite healthy. They belong to the left-hand side of the category, if you remember the previous slide, but about half of them start facing mild health problems. And regardless of health status, when we ask older people what they need the most, one of the most significant answer would be health services. So this is quite interesting, since most of them are actually still quite healthy, but they start to feel insecure or start to feel the need of health services for their well-being. So based on this data, we created an integrated older people care. What we want to do is to connect 2 green boxes as depicted in the right-hand side of the presentation. The upper green box is for older people and their families. And then in the lower green box is filled by different level of services. Services that are available in the village level, sub-district level, and city level, even in the nation level. Starting from community-based cares, community-based organization, up to national level hospital. We do think that a lot of programs that conducted under the bigger green box are not quite well coordinated. And in order for us to be able to provide holistic care and comprehensive services to the older people who need it, we have to be able to put everyone on the same table and see cases of older people needs as something that have to be discussed more comprehensively. That's why we are putting the blue box in the middle of those 2 green boxes. So this blue box consisting of people, they are working on the case management process on the field. They are social workers, health workers, volunteers, cadres, people who have been working with older people so far in the community. And we provide them with trainings how to better plan for older people care and how to put all programs together into one coordination in the implementation level. So social workers, for example, will have very good knowledge on programs provided by the Ministry of Social Affairs. Health workers will have a good knowledge on what are the programs provided by the Ministry of Health. And we kind of provide a forum, a structured mechanism for them to coordinate and talk to each other. So they will be able to serve older people in a better way, in a more coordinated way, and in a more holistic way. So we call what in the middle as Care Hub. And in general, the system where they provide referral also services to the older people as the integrated older people care. Everything has to be based on Silani, meaning that they have access to the data, so they know the situation of the older people, the situation of their physical health, mental health, as well as their socioeconomic status, so they would know what would be a good program for this type of older people, as well as if there are some government subsidies available for them. Next slide. So to assist the system to work more efficiently, we develop what we call as Silani Digital Platform, or SDP. So the integrated older people care that is based on data, or Silani, is a system of services. So they should be able to provide the services with or without the assistance of the technology. But of course, we understand and we see that technology as an opportunity for us to better provide the services to the older population. So we developed a Silani digital platform last year, this year. And this is close to complete. SDP consists of mobile application and dashboard that can be used by both case managers and older people, as well as their families. So basically, this application tries to connect older people and the families to case managers and available services. Through the application, the older population and the families will be able to request for support, advice, services that they need in relation to the older people care provision in their household. This will also allow the case managers to conduct comprehensive assessment process using the domains that are used in Silani and providing services or referral based on the situation of older people based on their assessment. We also designed the system to be able to allow the case managers to update the situation of the older people, store the data, and connect the data to several types of policy making tools, such as targeting for social protection, as well as planning and budgeting system in the village level, even hopefully at the city and national level in the future. We developed the Silani digital platform supported by a human factor study that was also sponsored by ADB. And this has been mini piloted to 100 older people and case managers in 3 of 7 villages that have been collecting Silani data. So the coverage is still not large, and the usage of a digital application among older people in Indonesia is still also low. But we are trying to introduce this and see how this is going to be successful, and try to identify what type of older people group that will probably be needing the most this application and using it the most as well. Next slide. So our plan for the future development, well, it is currently still developing. As you can see that we are still in the process of piloting, and it's only covering about 100 people now. Hopefully in the future, we can expand the coverage of the application so it can be used in all 7 villages that are now included in the Silani pilot. However, in later this year, we have been able to expand the coverage of Silani to even more villages. So next year we'll probably be quite keen to also expand the usage of both integrated older people care system and the digital platform of Silani to be used in these villages as well. We would like to add more users in the application, so it's not only the case managers and the older people, but also service providers will be able to directly connect to the older population or the case managers in providing their services. We would like to develop the Silani digital platform capacity to include more rigor assessment and case management tool, allowing the case managers to work easier, and for us in the policymaking sphere to understand what is happening on the field, what are interventions that have been planned and conducted, and how we can plan for future policy for older people. We would like to develop more seamless connections between Silani digital platform and other systems, as well as the civil registration, the targeting for the social protection, electronic health reports, if possible. We would like to make this system and data to be useful from many point of views and sectors. And as for the integrated older people care, not necessarily related to the system. Of course, it's related to the system as well, but this is more macro view of the policy. We would like to expand the availability and quality of older people services. So we would like to be able to cover support for especially older people that currently do not have anyone in taking care of them, as well as developing a more financially sustainable system in the future. Currently, we don't have a lot covered in the social security system, but hopefully in the coming years, we will be able to create a better system and cover more older people in the system. Next slide. So this is the location of the Silani and Silani digital platform pilot. Those with blue suns are the location where we have piloted the Silani, and as you can see, they're located in Bali in Java, the most developed section of Indonesia. So we kind of hope that they are more savvy in using the technological device. However, we have expanded Silani data collection in several other locations, even the most remote location of Indonesia in the eastern part of the country, and to see if the digital platform will be working there. This is something that we would like to try next year. However, our motto is that we create the system, and the digital technology is something that is supposed to accelerate the system to be more successful. It means when we are facing some challenges, for example, there is no internet signal, or it is too difficult for them to be able to use the digital technology, we kind of hope that the general design of the mechanism of older people care will still be able to be applied in that location to make sure the well-being of the older population. I think that will be the last of of my presentation today. Thank you so much for the opportunity, and I'm looking forward to the discussion.
谢谢蒂娜的演讲。刚才您对印度尼西亚南澳服务体系的运行以及信息系统在这个养老服务中的作用，做了非常充分的、非常全面的介绍。谢谢您。我们现在开始这个问答环节。现在有一个问题，我们有一个问题就是。就是问这个朱勇理事长，我觉得其他的演讲者也可以回答。一个是 就是我们这个智慧平台对接的养老服务，用的是什么样的管理工具，是不是评估工具？因为中国正在要出台一些，现在有2个工具，以后还会有新的工具出现。这种回答一下。
我刚打开啊，主持人再重复一下什么问题？喂，
就是这个屏幕上写着，就是在智慧平台在这个对接服务时候使用的有哪些管理工具？特别是服务这个需求评估工具，用的是这个哪个？
主持人，你那边的那个声音不太好啊，我回答一下这个问题。我在平台上看到了那个有人提的一些问题啊。首先一个呢，在中国呢，现在这个智慧养老的平台啊，是应用的已经非常普遍了。就是服务的这个提供啊，老年人需求的反映啊，还有包括服务清单啊、服务的考核啊等等，都是通过，包括一些经费的补贴，都是通过平台来实施的啊。所以呢，就是就是那个问题是，现在啊，就是这个各级的平台都非常多啊。非常多的话呢，它就会导致一些服务的标准呐，还有就是它评估的一些标准啊，还不太统一，不太一样。这个是很正常的，因为是跟地方它的一个它的工作的目标啊、策略是有关系的，特别是跟地方的一个经济发展水平是有关联的。你比如说上海，它的这个因为经济比较发达，它对老年人这个提供的服务就会比较多一点，它的服务的清单就会比较多一点。那么它在老年人需求的评估上，它就尺度可以稍微放开一点，就是能够让更多的老年人能够得到最好的一些服务。相反的话呢，它就会要减少一点或者降低一些，是这个一个问题。所以平台啊，智慧养老平台现在是推进那个养老服务啊，从需求的提出服务的供给，一直到就是服务质量的一个评估和考核，包括一个政府的一个资金的补助等等，都是通过这个平台来实施的。所以这个平台的作用是非常大的。谢谢。
好，下一个，另外还有2个问题是需要丁娜回答的。
我这个聊天框里头，我要把我的
一个是这个
问题已经回答了
一个是这个服务这个设计好是服务是打包了，或者服务是购买。对，另一个是对，是2期。
Yeah, so can I answer the first question first?
Yes.
Okay, thank you. So for now, we link the application or the digital platform to available programs that have been conducted by the government through full subsidy. So the Ministry of Health, for example, they already have some services provided to the public health centers. And for the Ministry of Social Affairs, they already have some services provided to their social workers, as well as the residential homes. And there have been some programs provided by local governments and village governments as well. So we try to put all of those programs together in one coordination using this application. So currently there have not been a problem of of buying the services, since all of the programs that we put in the application are still the existing government programs that are fully subsidized by the government budget. But I can see that this will be something that we will have to develop in the future to start including services that are provided by private sectors or even public entities that are allowing for both the government and older people to pay separately. This is something that we are still thinking in the future, and hopefully there will be the future mechanism of this digital platform will allow us to do so, where some services provided through the platform or connected through the platform will include services that can be paid through insurance, for example, through out-of-pocket payment, or separated from existing government programs, but also paid by a government budget, for example. I think that would be the answer of that question.
第二个问题就是这个信息是不是在不同的，是不是可以共享？
Yeah, that would be the dream. That would be the dream. For now, the data can be accessed by the personnel that are working on the field that come from those various ministries. For example, it can be accessed by health workers that are part of the Ministry of Health. It can be accessed by social workers that are part of the Ministry of Social Affairs. And it can be accessed by older people cadres that are part of the Family Planning Agency. In the future, we would like this to be able to be shared and used together by several institutions, not only in the implementation level on the field, but also in the central level for planning and budgeting process in a more macro level. So what we are thinking is to actually link the data to several other data on older people that have been collected by other institutions as well, such as the Ministry of Health. They have electronic health record. We would like to see the opportunity of us in linking the data of older people of vulnerability in socioeconomic and physical to their electronic health record when available in the Ministry of Health. And the Ministry of Social Affairs will have some data as well on the previous services that have been provided to this older population. And this can be something that are quite useful for us in determining what are the needs of older people in these regions. So hopefully in the future, we will be able to actually build the interoperability and interconnection between Silani and other data system in other ministries, and can optimally use it for planning and budgeting purpose in covering services to our older population. Over to you, moderator.
谢谢丁长回答，谢谢主任。最后一个问题，我想问一下刘畅博士和其他两位的客人，因为就是我们从大家的演讲中看到，就是智能科技在养老服务的老年生活啊各方面的健康方面都可以实现很多功能，但是我想问就是哪些功能不能提供对养老服务中，就科技哪些不能提供，就是还需要人力来提供的，就是。
是，谢谢徐教授。对，那我先尝试回答一下。其实从大的理念上来说，我们一直在倡导的也是科技，它是一个 empowering 的工具，就是在赋能，要不然就直接赋能老人，或者是赋能 caregivers，所以我们还是觉得它不是一个替代或者这个 replacement 的这样的一个关系，所以特别是在这个老人的照护的这个部分，那就是具体实际的一些照护包括康复，包括长护，然后也包括 异样结合的一些 solution， 其实它一方面就是一些physical care。就是物理的这些照护的动作还是需要人来提供，然后另外呢，就是其实它的这个social content， 就是社交的和人之间建立这个真的这个长久的这个联系，这个我觉得其实也是不可能被这个技术是单纯替代的。所以更多的其实是通过技术来赋能，把更优质的资源、更好的这样的这些服务不管是社会服务或者是看护服务，能够去让它更加的有效的和更便捷的去提供给更多的需要的人。所以这个方向上，我们看到的也和我们在推动的也是更多是这个领域这个方向。看看其他的几位老师，特别朱老师这边有没有一些补充？
我没有。
谢谢刘畅的回答。Any more questions? Do have any comments? 朱勇有没有什么要回答其他两位？那我就放心了。以后将来的科技养老，不是老年人身上带着很多科技的产品，然后一醒来以后呢，床上到处都是电子的东西，电子东西，人还是需要一个非常重要的。好，谢谢的，谢谢，好，那我们今天上午，那我们今天上午的就结束了。好，谢谢大家，谢谢各位，
谢谢，再见，
拜拜。
Thank you so much.
Hi, thanks everybody. We will have the second part of the conference tomorrow, same time, same place, from 9 to 12. And the two topics tomorrow will be on new caregiving options and the emerging longevity economy. So thank you, and hope that you'll join the link tomorrow as well for another very interesting discussion, and then summary and closing remarks.
Thank you, Wendy.
Bye-bye. Have a good rest of the day, and thanks very much to all presenters and all participants.
Thank you. Thank you, everyone.